Guys, this is the second video on scapular work. We're going to work on depression. So if you're at a gym or have something that you can drive up into that does not move, by all means use that. So like some kind of dip bar or a bar on a rig with enough weight that you can't move it. It works really, really well. And so you can use that to go straight up. It's a little bit easier. But if not, we're just going to use a wall and we're going to allow our tissue to drive into it. So we're going to have to bend our body and then we want to drive in. So what we're trying to work on here is depression of our scapula. So your scapula should be able to elevate, retract, and then depress, which is going down. So we're just trying to work on some of that motion. It's a Pails and a rail. So we're having a 2-minute passive hold. Then we're going to do 2 contractions, contracting the tissue that we are stretching and the tissue that we are shortening. So your Pails and your rails, progressive angular isometric loading, regressive angular isometric loading. To you, the tissue you're stretching and the tissue you're shortening. And we always want to do that strengthening because then we maintain and keep the range, okay? So we're going to set that up. We're going to radiate tension. We're going to passively let that stretch for 2 minutes. And then we're going to do our Pails and our rails, okay? So if I'm going to do my left shoulder, I'm going to have a wall here. And what I'm going to do, I'm setting myself up. So I'm just popping that wall just there. And then I'm setting myself up so I can actually kind of let that. And I'm going to drive myself forward. So I'm going to go forward and my shoulder's going back and down. I'm trying to make that left arm passive. I'll show you from another angle. So if we're going to come here, I'm going to lower myself and I want to allow the shoulder to go back and down. And you're going to get that stretch range. So I want you to hold that for 2 minutes, 2 full minutes. Once you've hit 2 minutes, we're going to do our contractions. So we'll start that now. So we're going to take a breath in, trap the air in that lower abdomen. I'm going to radiate tension through my body and start to drive my shoulder up into that wall, rig, or whatever you're using. Hold that, ramping up greatest effort, and then hold it for 15 seconds. Breathe through that 15 seconds. I want max effort. 5, 4, 3, 2, 1. Your rails is the opposite. So now I'm going to try and actually depress. I want everything tightened, so you're almost trying to pull and depress away from the wall. Hold that for 15 seconds. 5, 4, 3, 2, 1, and then do it again. So you want to get that passive stretch again on the top of that tissue so that you can then do your second set of Pails and rails. Basically what you're doing, stretch the tissue, which a lot of us do in all sorts of activities. Then we strengthen that end range, both the tissue you're stretching and the tissue you're shortening, which means your nervous system learns how to control that range. So we stretch that tissue, contract the lengthening tissue, contract the shortening tissue, then go further because we open up about 15, 20 degrees of range and you want to absolutely do 2 sets so you can go further into that range and actually really work and open up new range. Then repeat the sequence, passive stretch, contract tissue you're stretching, contract tissue you're shortening, find new range, repeat. Okay, give that a go for shoulder.